Nikki, you're on mute.
Sa mga nakatutok sa ating Facebook at YouTube pages saan mang bahagi ng bansa, sa ating mga media partners at sa inyong lahat, magandang hapon po. Ako po si Nikki Necesario, isang Juana mula sa Kagawaran ng Kalusugan, and welcome to our today's Kapihan. Bago po natin turuyang umpisahan ang ating talakayan ngayong araw, narito lamang po muli ang ating mga house rules. Next slide, please. Thank you. To ensure the smooth flow of this session, everyone is encouraged to, number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and or resource persons. Number 3, keep your microphones muted while speakers are discussing and presenting. And number 4, should you have queries, participants shall signify and send questions in the Zoom's chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box question. Every participant is advised to reserve questions. Muli po, paalala sa ating mga media partners na panatilihing related sa ating topic for today ang mga katanungang itatanong. Ayan. So now more than ever, talagang mas dapat bigyang pansin ng ating paksa para ngayong araw. Dahil bagaman hindi gaanong nagmamanifest physically ang mga kondisyong ito, ay hindi ito nag-i-exist. Kaya naman para sa hapong ito, isa sa ating tatlong speakers ang magpapaliwanag tungkol sa clinical treatment for mental health conditions. We have with us today Dr. Rodney Boncajes, FPPA, Medical Specialist for Psychiatrist, at Chief ng Office of the Special Concerns ng National Center for Mental Health. Magandang hapon po, Doc Rodney.
Hello, isang malusog na hapon sa ating lahat at sa lahat ng ating mga kasama ngayon na media partners at sa ating mga taga-subaybay sa live stream. So yan, magandang hapon, Nikki. Sige, simulan ko na ha. Mag-share na ako ng aking slide. Okay, so yan. Ako po si Dr. Rodney Boncajes ng National Center for Mental Health, and for this afternoon, pag-uusapan po natin ng mabilisan lang ano ba yung mga clinical management para sa mga pangkaraniwang mental health condition. So pag sinabi nating mental health condition, ang definition na ginagamit natin according sa Mental Health Law or Republic Act 11036 ay ito yung mga neurologic or psychiatric condition na characterized by the existence of recognizable and clinically significant disturbances, specifically in the cognition o yung sa pag-iisip, emotion, and doon sa behavior na nakakaapekto ng malaki doon sa kakayanan or functionality ng isang individual. Marami pong mga mental health condition tayo na nakikita at ang ilan po sa mga yon ay yung makikita natin sa ating screen. Meron po tayong tinatawag na neurodevelopmental disorders and other childhood disorder. Meron po tayong tinatawag na neurocognitive disorders such as dementia and delirium, substance use and addictive disorder. Yun pong pinakang nakikita natin kalimitan sa sa kalye o yung sa mainstream media, yung portrayal ng mga individual na may schizophrenia or psychosis kabilang sa schizophrenia spectrum and other psychotic disorders. And of course, yun pong bipolar disorder and depressive disorder na tinatawag din natin na mood disorder. Nandiyan din po yung anxiety disorder na mas lalo nating nakikilala nitong mga nakaraang COVID-19 na panahon dahil marami yung naapektuhan. Meron din pong trauma and stressor-related disorders katulad ng acute stress disorder, post-traumatic stress disorder at iba pa. And kasama din po yung mga disorder or condition na may kinalaman sa pagkain such as feeding disorder and eating disorders katulad ng anorexia nervosa, bulimia nervosa. And meron din po tayong mga kondisyon na may kinalaman dun sa tulog or sleep-wake disorders. At marami pa pong disorders kasi napakarami naman po talaga nila. Ngayon, kung ito po yung mga kondisyon na kalimitang nakikita ng isang mental health professional or specialist or even ng ating mga doktor na may kakayahan naman na mag-identify or mag-determine ng mga ganitong mental health condition, importante din po natin malaman na marami pong uri ng paggagamutan or clinical management na pwedeng makatugon sa mga mental health conditions na nabanggit. Of course, pangunahin po doon sa mga listahan ng management is yung pagbibigay ng nararapat na gamot or psychopharmacology. So, yun pong nabanggit kong mga kondisyon kanina, meron po din itong katumbas na iba't ibang mga medication or paggagamutan specifically for those condition. So, mamaya po titingnan natin ano-ano yung mga yon. Maliban po sa paggagamutan, may tinatawag tayong mga psychotherapy or psychotherapy sessions or simply as therapy as another mechanism or way of handling or managing this condition. Meron din po tayong mga tinatawag na psychiatric rehabilitations at iba pang intervention. Pwede din po na yung individual na may mental health condition ay atin ding ma-refer sa iba pang mga discipline or sa iba pang mga specialista upang ma-manage yung iba pang mga kondisyon maliban dun sa kanilang mental health condition. Halimbawa po, kailangan nating i-refer sa internal medicine para sa management ng hypertension, ng diabetes, or ng kanilang thyroid problem kung sa example po. Meron din pong mga other somatic therapies na tinatawag katulad po ng transcranial magnetic stimulation or ng ECT. Ito po yung paggamit ng mga device na pwedeng makatulong upang direkta na magkaroon ng mga changes doon sa ating isip or sa ating utak. And then, part din po ng clinical management, yung iba't ibang levels of care or yung pangangalaga depende po doon sa level or antas ng pangangailangan ng isang individual. So, mabilisan lang po, no? Pag inisa-isa po natin sila, halimbawa po dun sa psychopharmacology or paggagamutan, ito na po, no, yung kalimitan, familiar na tayo dito. Pagbibigay ng mga gamot katulad ng antipsychotic para dun sa mga individual na may schizophrenia or may psychosis, antidepressant, yung mga gamot na ginagamit natin laban sa depression or pagtatama ng mood para sa depression, mood stabilizer para sa mga bipolar disorder, anxiolytic o yung anti-anxiety medication, mga gamot po na makakatulong para doon sa may problema sa tulog, stimulants para sa mga pasyente or service users na may ADHD, at iba pa pong gamot. Pag naman po sa psychotherapy, marami din pong mga uri or forma ng psychotherapy. Nandyan po yung cognitive therapy, behavior therapy, interpersonal therapy, at family therapy, couples therapy, at iba pa pong paraan ng mga therapy. Doon naman po sa psychiatric rehabilitation and other intervention, dito po pumapasok yung intervention maliban sa paggagamot at therapy katulad ng vocational rehabilitation o yung pagsasanay uli doon sa ating mga service user na naapektuhan yung kanilang skills or kakayahan upang makapagtrabaho. So pwede po silang mabigyan ng mga rehabilitation na nakafocus doon sa kanilang vocational skills. Or pwede din naman pong social skills rehabilitation lalo na kung nahihirapan na sila or nahirapan sila ngayon na makipaghalubilo sa iba. So meron pong mga rehabilitation program na nakadirect po doon sa ganong klaseng kakayahan. And dito po sa Pilipinas, siguro po yan, nagsisimula na rin na magkaroon ng mga genetic counseling para po doon sa mga family members na meron talagang strong predisposition to have mental disorder upang mabigyan din po sila ng maayos na pagpapayo kung paano yung kanilang pagpapamilya. Yung iba pa pong management would include consultation to other disciplines. Yun nga po yung nabanggit ko kanina, no? Meron po kasing mga individual na may mental health condition na meron din silang iba pang medical condition or even surgical condition. So ito po yung nire-refer natin sa iba pang mga specialista upang yung paggagamutan sa kanila or treatment ay holistic. Ibig sabihin po nun, hindi lang natin tinututukan yung kanyang mental health concern but tinututukan natin yung buong pangangailangan ng kanyang physical health or overall health. Yun pong iba nare-refer doon sa tinatawag natin geriatrician or geriatric psychiatrist kasi meron pong mga member ng populasyon na may edad na or ating mga senior citizen na specialized po yung pangangailangan nila. So nare-refer po sa ibang discipline katulad ng geriatric psychiatry or even psychiatric emergencies, lalo na po doon sa mga pasyente or service user na kailangan kaagad na matugunan yung kanilang pangangailangang mental dahil sila ay nasa distressful na situation na. Yung levels of care naman po bilang panghuli would include yung iba't iba pong antas ng pagbibigay serbisyo katulad ng inpatient admission. Kung kailangan po na yung ating service user or pasyente ay ma-confine or ma-hospital ng ilang araw upang tuloy-tuloy na maobserbahan yung kanyang kondisyon, mabigyan ng tamang gamutan at magkaroon po ng somehow ay maging ligtas or mas safe yung environment, pwede po siyang ma-admit or inpatient admission. Meron din po na tinatawag na partial hospital treatment, intensive outpatient treatment. Of course, yung outpatient care po is yung regular na pagpunta sa OPD or yung tinatawag natin or commonly known as check-up lang, and then uuwi din sila after nilang makita or makausap yung doktor at mabigyan sila nung kanilang reseta or intervention. And meron din po tayong tinatawag na residential care na kung saan yun pong ilan sa ating mga service user or pasyente ay wala sila sa loob ng ospital pero naka-admit sila or inaalagaan sila sa isang facility na kung saan ang kanilang setup po ay hindi hospital setup but more of setup that can support their daily living. So ito po yung iba't ibang clinical management. Now, siyempre po ang pinag-usapan po natin ng mabilisan is yung mga management at hindi naman po natin talaga matututukan yung lahat ng bawat isang management sa bawat isang specific disorder. Kaya pinesent ko po siya ng mas generalized. Pero maliban po doon sa pagtutok natin sa mga individual or service user na meron ng kondisyon, as importante din po na maagapan yung pagkakaroon ng mga ganong klaseng kondisyon. Kaya pinapakita ko po ngayon sa screen natin na meron po kaming NCMH crisis hotline na kung saan yun pong mga individual na nangangailangan ng makakausap or sa palagay nila ay kailangan nila ng tulong na professional at gusto nila ng isang lugar or safe space na kung saan meron silang makakausap na handang makinig sa kanila, pwede po silang mag-reach out sa mga telepono or numero na nasa ating screen at ito po ay 24/7 or bukas araw-araw at sa lahat ng oras. Ayan, pwede po kayong mag-access using these numbers on your screen. Meron po kaming nationwide landline toll-free number at meron din po kaming Globe and TM and Smart and Sun and Talk and Text numbers para sa ating mga gustong tumawag sa atin. Yan. Again po, ako po si Dr. Rodney Boncajes at yun po yung ating maiksing presentation about the different clinical interventions for mental health conditions. Maraming salamat po.
Ayan. So maraming salamat po Doc Rodney sa pagtatalakay kung ano ang mga mental health conditions at kung paano ito maaaring malunasan sa pamamagitan ng mga therapy, gamot at mga rehabilitation. So para sa ating mga kababayang nangangailangan ng tulong, nariyan ang ating crisis hotline, just dial 1553 at ang ilan pang mga numbers na pinost ni Doc Rodney kanina at 24/7 po ito available. Ayan. So mamaya makakasama po natin muli si Doc Rodney para sa ating Q&A portion. Para naman po sa ating susunod na speaker, at dahil batid ng kagawaran ang holistic na pagkalinga sa ating mga wanatana, para talakayin sa atin ang mental health programs and strategies ng kagawaran ng kalusugan, makakasama natin ngayon si Ms. Lindsay Orlino, Supervising Health Program Officer ng Specialty Care Division ng Disease Prevention and Control Bureau ng Department of Health. Good afternoon, Ms. Lindsay.
Hi Nikki, magandang hapon and good afternoon po sa ating mga media partners and of course to our colleagues Dr. Rodney and si Dr. Fonsi. So for this afternoon, I'll be providing a very short discussion on the National Mental Health Program ng Department of Health and of course kung ano ba yung overall strategy natin for mental health. Next slide please. Yan. So yung ating National Mental Health Program is guided by the Mental Health Act of 2018 or yung Republic Act 11036, which is now on its 5th year of implementation. So the law has the following objectives, 6 objectives, meaning strengthening yung effective leadership natin and governance for health, developing a comprehensive integrated mental health care system, protecting the rights and freedoms of persons with psychiatric, neurologic, and psychosocial health needs, strengthening of course yung ating mga information systems and yung mga researches natin on mental health, integrating mental health care in the basic health services, and integrating strategies that promote mental health in educational institutions, the workplaces, and in the communities. Next slide, please. Yan. So yung overall initiatives natin is mainly guided by this 4 pillar, mainly yung prevention and promotion, governance and leadership, yung mga mental health services natin, and information and research. And collectively, this all help us achieve yung ating mga overall goals, which is to value, promote, and protect yung mental health. We wanted to make sure na yung mga mental health conditions natin are identified, treated, and prevented, and that yung mga persons affected by mental health conditions or ang ating mga service users ay are able to exercise the full range of human rights. So collectively, when we all achieve these goals, we will now make sure that yung ating mental health and well-being ay provided for all Filipinos. Next slide, please. Yeah. So since the implementation of the Mental Health Act noong 2018, marami na tayong naging milestones in the implementations of the law, from policy development to different capacity building initiatives. And we are also continuously taking on different initiatives na nag-i-improve yung access to mental health services. So for example, in terms of strengthening yung effective leadership and governance for health, nagkaroon tayo ng mental health division sa Department of Health, which na in charge sa implementation ng law, and nagsiserve siya as Secretariat for the Philippine Council for Mental Health. Now, yung Philippine Council for Mental Health, this is a sectoral body, advisory body to the government on different mental health initiatives. And we also have the Mental Health Strategic Plan for 2019 and 2023. And we have also employed several leadership capacity building design for governors and our local chief executives to further promote and prioritize mental health in the LGUs. So in terms of improving access to care, marami na rin tayong mga ongoing efforts, one of which is yung Medicines Access Program natin for mental health, with currently 362 identified access sites nationwide, offering about 27 medicines. And we're also implementing yung massive capacity building natin for primary care workers using yung WHO Mental Health Gap Action Program Intervention Guide. So isa itong tool which includes interventions for the prevention and management of priority MNS conditions. So ang target talaga nito, itong ating mga non-specialists and non-specialist providing healthcare sa non-specialized settings also. And we also pilot tested yung PhilHealth Mental Health Benefit Package natin nung late months in 2022 na which aims naman to assess yung readiness ng mga facilities natin and yung Medicines Access Program sites and in target regions. So these are just some of the interventions that we are currently doing in order to provide access pa to mental health care to our Filipino people. And other capacity building initiatives includes yung pagtitrain ng ating mga people with lived experiences so they can be advocates and leaders in terms of advocating for mental health. And we've also pre-tested yung basic suicide prevention modules in schools, both for teaching and non-teaching staff early this year. And other policies that are already in place include yung mga DOLE and CSC policies natin on mental health in workplaces. So kung makikita dito sa slide na to, it's really a wide range of intervention, not just within the health sector, but also in close coordination and partnership with our national government agencies and other sectors pa in order to implement a very holistic approach to mental health. Next slide, please. Yan. So the following slides naman will be briefly discussing yung how our strategies are in integrating mental health into general health and community settings. Next slide. Yan. So I'd like to begin na we should all be in recognition of the multifactorial nature of mental health and well-being. Meaning, yung ating mental health po, maraming factors na nakaka-apekto sa overall mental health and well-being ng isang individual. And yung mga established association ng mga mental health condition with yung mga unhealthy activities natin, mga unhealthy practices, risky behaviors, yung mga existing relationship natin with our friends, our families, our communities, of course, different socioeconomic influences and other structures. Hence, as we always like to say, no, the health sector cannot do it alone, and everyone has a role to play in promoting and protecting our overall mental health and well-being, and that includes transforming the environments that we live. So to be able to make our environments healthier, our schools, our workplaces, our communities, we need to mobilize other sectors and other national government agencies, other key players, para po maging mas ligtas at maging mas healthy itong mga environments natin that would enable us to have better mental health and well-being. So nandito lang po yung some of the common mental health risks and preventive factors na evident sa individual, family, community, and structural level. So for example, no, ano-ano nga ba yung mga risks na nakakapag-undermine ng mental health ng isang individual? So at the family and community level, nandito yung presence ng sexual abuse and violence, yung mga emotional and physical abuse and neglect, poor living conditions, mga dangerous neighborhood, difficult family relationship, even job strain, job losses, and unemployment. So ito lang po yung ilan sa mga halimbawa ng mga risk factors na nakakaapekto sa ating overall mental health and well-being. Next slide, please. So as we go about yung mga strategies natin, no, we have identified yung mga gaps and implementation challenges along the way. And while we recognize that mental health is treated as a highly specialized care, we also wanted to address yung long-standing gaps natin, and of course, build preparedness in terms of coverage and quality of care, and slowly shift from a very specialized care to a more general and community-based setting for mental health. Next slide. So we now aim to strategically shift in focus from very specialized services to integrating mental health into the general health and community setting. So among our priorities is really promoting yung mental health in the community settings while utilizing yung mga community resources available, implement yung mga step-up low-intensity interventions, including self-help support and early or mild difficulties in community setting, and of course, integrate yung mga mental health services into primary care with particular focus on common mental health disorders. So this time, while we recognize then yung importance, of course, of having yung mga specialized facilities natin, which is also equally important, we also wanted to prioritize yung mental health promotion talaga on the ground and in the community setting. So we wanted na hindi na sana natin mapaabot doon sa oras na kailangan na natin iakyat ang ating mga patients into higher level of care. So what we wanted in the future, hopefully, at the level of the community, at the level of the family and different settings ay lahat ng players ay may capacity to manage or prevent yung mga mental health conditions from getting worse. Next slide. Yan. So this is just to show na yung current work rin natin ay mostly inclined to integrating yung mental health into general care. So yung mga MH gap training natin for our primary care workers, leadership and advocacy training for our people with lived experiences, adopting yung live life strategy sa schools. Ito yung basic suicide prevention that we pre-tested for both teaching and non-teaching staff, innovative capacity building for our local chief executives, and a training package for community-based mental health in select pilot sites. Next slide. Yeah. So one of the recent strategy that we are currently building is really to integrate yung mental health sa community settings natin, no? And through the technical assistance of the World Health Organization, we have developed a community-based mental health framework in 2021, which was initially piloted in Lemery, Batangas. And early this year, we improved this capacity building training package para sa mga LGUs and piloted this sa mga selected sites. So overall learnings from this pilot will form part of the overall strategy for community-based management ng ating mga mental, neurologic, and substance use condition. So in summary lang, yung mga framework natin, yung CBMH framework natin consists of the following pillars, yung engaging the community, talagang i-identify natin sino-sino yung mga key stakeholders natin on the ground, building yung mga capacity nitong mga stakeholders na to, strengthening the family and support groups. We all know na yung family and yung mga peers natin and different units pa society are very important groups that contribute nga to the overall and well-being of an individual. Of course, empowering the service users themselves, and of course, ensuring continuity of care na while we identify yung mga potential service users natin at the community, we wanted to make sure na mayroong tamang referral to the higher levels of facility and yung referral to the appropriate social services that they need also. Next slide, please. I think si Dr. Fonzie will be going through this slide also, but essentially, we just wanted to reiterate no, na the importance of health promotion and prevention to make our physical and social environment na maging healthy and health promoting, so that regardless of our socioeconomic background, we are able to practice health behaviors. So next slide. Yan. So in protecting and enabling Filipinos to care for themselves in their community, the move is to make sure that we have integrated strategies for healthy and safe settings. And in taking care of Filipinos when they need it, the move is to make sure that we have integrated and life stage responsive care guiding management when people seek for care. Next slide. Ayan. So everyone has a right to mental health, and the Department of Health, together with our national government agencies and other partner stakeholders, are working hand in hand no, para po mas maging maayos ang ating mga settings, ang ating schools, workplaces, and communities that are more responsive to the mental health of the Filipino people. Thank you.
Ayan. So maraming salamat po, Ms. Lindsay. So mahalagang nakita natin na naririyan ang efforts ng kagawaran sa pag-integrate ng mental health sa ating primary care needs. Ngayon ding nakikita natin na talagang mahalaga ang awareness at health promotion upang maagapan natin sa self at household level ang ganitong mga kondisyon. Again, so last but not the least, para sa ating ikatlong speaker, narito si Dr. Alfonso Regala, Medical Officer 4 at lead ng Behavior Change and Social Mobilization of the Health Promotion Bureau of the Department of Health, upang bigyan tayong kaalaman on designing behaviors for mental wellness. Good afternoon, Doc Fonzie.
Thank you, Nikki. Magandang hapon. Can we pull up the slide? Ayan. So, kanina ang ganda no, nung simula natin. Ano yung clinical natin? And then nag-zoom out tayo konti, sectoral, and si Lindsay also touched on what happens in the communities. I would like to emphasize on that more. No? Ano ba nangyayari for mental wellness in our communities? Is it really possible for us to design healthy behaviors for mental wellness? If yes, paano? Diba? Next slide. So when we talk about health outcomes, yung traditional na alam natin, no, ang pumapasok sa isip natin, yung mga nangyayari sa ospital, sa loob ng mga health facilities. So it actually, these things, the medical care and what we conventionally know of health, only accounts for 20% of health outcomes. The rest of the 80% happens outside of them. So it's so much more important to look at health behaviors, to look at your physical environment, and to look at your socio-economic factors. Tama po yung sinabi ni Lindsay na dapat kahit ano man ang estado mo, dapat may access ka to healthcare. Pero kailangan natin malaman ang iba't ibang tao ay naipanganak sa iba't ibang estado. Kaya mahalaga po, next slide, na tayo ay nag-i-invest sa health promotion. Because health promotion allows us to respond to 80% of these health outcomes. Ano man ang estado mo sa buhay. Dapat parehas ang investment natin sa mga clinical services, pati doon sa mga nangyayari sa ating communities. That way, we are truly able to protect and enable Filipinos to take care of themselves and their communities. Next slide. So pag sinabi po nating health promotion, meron tayong 7 priority areas, each corresponding to a healthy habit. Kaya nga po tawag namin dito, the 7 healthy habits para sa healthy Pilipinas. Isa po dito sa priority areas natin ang mental health. No? Dahil walang health kung walang mental health. Next slide. So ano nga po ba ang health promotion pag sinabi natin ito? Paulit-ulit kasi natin sinasabi. So health promotion is a process of enabling people to increase control over and to improve their health and its determinants. Sa madaling sabi, ang gusto lang ng health promotion is to make the healthy behavior the easier choice for everyone, every time, everywhere. I like to repeat that again. No? It means making the healthy behaviors the easier choice for everyone, every time, everywhere. And when we talk about mental health, the corresponding healthy habit is to care for yourself and to care for others. So how do we make this easier to do? Next slide. So the health promotion framework strategy outlines 3 key areas on how we can design healthier behaviors. The first one is health literacy, that all Filipinos should be health literate. Second, the settings where people are born in, live, grow, work, play, and grow old are health enabling. Pangatlo po, that public policies are supportive and protective of health. So this is healthy governance. Isa-isahin po natin. First is health literacy. Next slide. You may be more familiar with what we do on health literacy. This is what is the conventional campaigns, all of the materials and information and education collaterals that we have. I wanted to highlight some, including those that we have done with our sectoral partners. So one of our more recent materials is our self-care kits developed with Mental Health PH. So these are self-care activities that users can use, can read at their own pace. Hindi po siya kailangan basahin from start to end. So there are 2 self-care kits. One is called A Seed of Courage and the other is called A Garden of Compassion. Our second material is our Lusog Isip application. So this is your mental health and wellness app that tackles several evidence-based interventions from Katatagan, which is the module for resilience, Ginhawa health awareness, compassion and forgiveness interventions. It's all there. So as of last year, December 31, there's over 10,000 users already. And both of these are free and accessible online. Next slide. So we also have our info education entertainment. So we have a series that ran online and on TV, sa Signal TV. It's Mind School. It's a series targeted for adolescents and children, exploring topics on mental health and substance use. One, it provides a venue, a way for kids and adolescents to be able to talk about these things. And second, it helps provide healthier coping strategies when faced with stress. Next slide. We also have a long-standing campaign on adolescents. So that's Let's Talk Adolescent MH. So it tackles issues faced by adolescents, including mental health and wellness. So sa ngayon po, meron na siyang 13.5 million views on TikTok. So we're trying to find different platforms that could reach our specific target audiences. Hindi na po sapat na meron tayong mga briefing, na meron tayong nilalabas na materials. These emerging platforms are also important because our kids, our adolescents, our teens are there. Next slide. So we're done with the first strategy, which is health literacy. How else can we design healthier behavior? Hindi po sapat na alam lang nila kung paano o kung ano yung behavior na kailangan nilang gawin. Dapat po yung community nila, yung kanilang LGU, yung kanilang eskwelahan, or yung kanilang workplace enables them to practice that behavior. This is why the health promotion playbook was born. No? So it's an all-in-one guide for LGUs to implement health promotion interventions so that healthier behaviors are easier to do. Next slide. Kung maalala po ninyo, the very first playbook was our playbook on active transport. This was the time nung walang masakyan yung mga tao, no? And we saw the need for active transport, a cheaper way and a healthier way to travel. This is the summary of the content of each of the playbooks corresponding to the 7 priority areas. It has an evidence brief, a template policy, hanggang FAQs yan and M&E plan. Kaya po siya playbook because it's the starting point that our LGUs can localize to their context depending on their need. They need not have to start from scratch. Next slide. So we have our specific playbook for mental health that's establishing peer support groups for the youth. So this module builds social support structures in the community through organizing youth-led peer support groups and serve as an early intervention to mental health problems or mental health concerns among the youth. Ito po yung nabanggit ni Lindsay kanina na sana pwede tayong mag-intervene earlier before they manifest symptoms, before they manifest concerns. Is there a way? Is there a safe space for us to talk about, for our kids, no, to talk about mental health concerns? It is your peer support groups for the youth. Next slide. So just briefly, the peer support groups for the youth was outlined following the action areas for health promotion mentioned by our Ottawa Charter. No? So that's the foundational document for health promotion. It has to have healthy public policy. It has to create supportive environments, strengthen community action, develop personal skills, and reorient health services from therapeutic to cover the entire spectrum and include preventive and promotive services. Next slide. For our schools, we piloted last year our healthy learning institutions. So ano po ba ang isang healthy school? A healthy school or a healthy learning institution is any school that implements the 6 pillars of a health promoting school. It looks familiar with our LGU playbook, no? The 6 components. These include healthy school policy, your physical school environment, your social school environment, links with community, especially including the parents, including other organizations in the community. It also includes health skills and education, and lastly, access to healthcare. So again, a healthy learning school is a school that implements interventions across these 6 pillars of a healthy learning institution. Next slide. So that's number 2, healthy settings, our LGU and our schools and also our workplaces. There have been several policies, no, for our third strategy, healthy governance. There have been several policies issued already for mental health, but I'd like to zero in on one of our more recent ones, the Administrative Order 2022-0004, or our guidelines for ethical and responsible reporting and portrayal of suicide in media, audiovisual, and films. Now, next slide. Its main objective is really to reduce the incidence of suicide through responsible and ethical reporting and portrayal, proper handling of suicide events, and in developing material that increases help-seeking behavior in our communities. So ang sakop po niya malawak, no? Media, audiovisual, film practitioners, pati po yung ating mga independent bloggers and citizen journalists. No? Next slide. So some key principles, it aims to protect those at risk for suicide and those who have died from suicide. It also aims to uphold freedom of speech, freedom of expression, and freedom of the press. So our practitioners and organizations are encouraged to practice self-regulation in line with this policy. Next slide. So one of the major areas outlined by this policy is to build capacity. No? It identifies the role of the DOH in developing and promoting resources and programs for this. It also encourages our practitioners and our organizations to develop policies, guidelines, and activities aligned with this administrative order. Kasi kailangan din po namin yung tulong ninyo. Next slide. So I just like to highlight three pointers from the policy. No? So for news outlets, radio stations, journalists, we really need to provide reliable info on suicide and its prevention. On its own, it's already a difficult challenge to take on. No? And how much more if there is misinformation and fake news. So let's prevent the spread of this. Next slide. So we also need to be certain of the facts of the incident. No? We need to avoid reporting that a death is a suicide unless it's already been confirmed by our law enforcement authorities. It's also important to note that causes of suicide are complex. We cannot just attribute it to a single cause. No? I'll give an example in the next slide. Next slide, please. Yeah. So for example, instead of saying a student died by suicide yesterday over rising tuition fees, the recommendation is just really to say a student died by suicide yesterday. Next slide. We also need to avoid describing the details of the suicide because this may risk getting inadvertent attention to the details. So we are also discouraging publication of the suicide note or any related letters. For example, next slide. So instead of saying a man died by suicide by jumping off of the 37th floor of building X in blank city, you just mentioned a man died by suicide in Garden City. Next slide. Our last pointer is to be careful with the language used. We avoid language that belittles, language that blames, and language that shames. No? So this is to protect the people who have thoughts of suicide or have had past suicide attempts. At the same time, we do not want to glamorize or normalize suicide. We need to remain neutral on it. So those who have had suicidal thoughts or who will have them in the future should not be stigmatized by the language that we use. It's important because the language that we use shapes the perceptions and the interactions of behaviors towards other people and even behaviors towards the self. Next slide. So instead of saying the lonely woman died by suicide only to gain attention, we just say the woman died by suicide. Next slide. So as a summary, I tried to show, is it possible to design healthy behaviors for mental wellness? The answer is yes. And we can make the healthy behavior the easier choice through health literacy, through healthy settings, and through healthy public policy and governance. Thank you.
Ayan. So thank you very much, Doc Fonzie. Talagang napakarami naming napulot kung ano mga importanteng habits na meron tayo upang mapangalagaan ang ating wellness. Gayon din ang tamang portrayal o pagbanggit sa suicide at tendencies nito sa media. So talagang umaapaw tayo ngayon sa impormasyon at hindi na rin natin patatagalin pa. Tinatawagan po natin muli sina Doc Fonzie, Doc Rodney at Miss Lindsay para sa ating question and answer portion for today. Ayan. So, para po sa ating first question for today, para po sa ating mga kasamang doktor today, no? Marami pong tao ang kadalasang hindi alam na mayroon silang mental health condition. Ano po ang inyong maipapayo sa kanila at what are the things we should look for in identifying this? Si Doc Rodney na lang po muna and then si Doc Fonzie.
Okay, sige. So sa panahon kasi ngayon na yung malaya na tayong nakakagamit at hindi naman limitado yung paggamit ng social media or ng internet in general is nandoon din naman talaga yung opportunity to really look for doon sa nararamdaman mo. Pero syempre yun yung isa sa mga iniiwasan natin kasi ang gusto natin is magkaroon sila ng tamang information about mental health kasi hindi naman lahat ng mga information na makukuha natin sa internet can be really parang proven na may basis or talagang backup by evidence. So kung halimbawa yung isang individual ay nagkakaroon ng mga experiences or naiisip or nararamdaman na hindi na ito yung usual niyang nararamdaman before at nakakaapekto ng malaki doon sa kanyang kakayahan na alagaan ang kanyang sarili or self-care, kakayahan na makisalamuha sa iba or interaction with other people, or kakayahan na mapakita yung kanyang productivity through work or through school, ito na yung tamang panahon siguro para siya ay humingi ng tulong or makipag-usap. So ang pinakang unang kailangan gawin is makipag-usap. Kailangan maintindihan niya kung ano yung nararamdaman niya or ma-validate kung ano yung kanyang mga naging experience. And yon, maliban sa pakikipag-usap is dapat din nakakakuha siya ng tamang suporta doon sa mga taong lalapitan niya kasi 'di ba ang gusto nga natin is maidala siya doon sa pinakang appropriate na service or need na makakatulong sa kanya. So dapat yung mga taong lalapitan niya is naiintindihan din kung ano mismo yung pinagdadaanan ng isang individual.
Ayan. Thank you po, Doc Rodney and Doc Fonzie. Would you like to add something po?
Oo, siguro Nikki, maiksing dagdag lang, sususugan ko lang yun. Siguro kailangan din natin tingnan na ang mental wellness ay hindi switch. Hindi siya, meron na akong mental health condition or wala. No? So spectrum siya. Kaya napakahalaga yung sinabi ni Doc Rodney na maging aware tayo when it affects already our capacity, no? Yung daily activities natin. Ang pangdagdag lang siguro natin doon, napakahalaga na makipag-usap tayo sa iba. So napakahalaga yung kataga natin na kamusta ka? Kasi tatanungin mo yung tao eh. Hindi siya in position sa privacy niya. Kasi pwede siyang sumagot na hindi ako okay pero I still don't want to talk about it yet. So yung importante po yun, yung kamusta ka kasi merong klaro na gusto mong tumulong pero klaro rin na choice nung tao kung gusto ba niyang pag-usapan ngayon o hindi.
So maraming salamat po Doc Fonzie and Doc Rodney. No? So para sa ating mga tagapanood ngayong araw at kung may kinakailangan po kayong sabihin at wala kayong pagsabihan muli, no, nandyan yung ating crisis hotline. Dial 1533 lamang po at ang iba pang mga numbers na pinost na ni Doc Rodney. Ayan. So para naman po sa ating susunod na tanong para sa araw na ito, para po sa inyong lahat, no, kay Doc Rodney, Doc Fonzie at Ms. Lindsay, para naman po sa mga may kamag-anak, kaibigan o kakilalang mayroong mental health condition, may tama po bang paraan ng pag-approach sa kanila? Doc Rodney, Doc Fonzie, and then Ms. Lindsay to answer po.
Okay, yan. Meron talagang tamang paraan kung paano ina-approach yung mga individual na lumalapit because of the mental health condition. Kasi sabi nga natin, kahit sa panahon ngayon na marami na tayong information about mental health, hindi pa rin naiiwasan yung stigma. And the stigma can be coming from different angle. It can be coming from the individual itself. It can be coming from the environment. It can be coming from from somewhere else. So paano ba yung tamang approach? So number one is we need to create an environment that would facilitate open communication. So dapat ma-set muna natin yung environment na kung saan bukas tayo sa pakikipag-usap sa iba. So paano natin ginagawa yun? For example, as simple as meeting the person in private space, if possible, to maintain confidentiality and privacy, be welcoming and conduct, for example, words that is culturally appropriate during the situation, maintaining eye contact, use of appropriate body language, what else? Yon, explaining as well that the information that will be discussed or exchanged between the two would remain confidential or will be kept confidential. So second is involving the person. So when we say involving the person, we include the person who is, of course, with the consent niya na yung kakausapin siya. At kung kinakailangan pa na tanungin din yung ibang miyembro ng family o yung ibang tao na makakatulong para mas maintindihan lalo yung sitwasyon na pinagdadaanan ng tao na yun, pwede din namang i-involve sila basta may permiso or consent nung individual na humihingi ng tulong. Pangatlo is of course yung start by listening, makinig. So when we say listening, it's not only listening but listening empathically and sensitively. So when we say empathic, ibig sabihin yung meron tayo dapat na kakayahan na ipwesto yung sarili natin doon sa kinakausap natin and then maging sensitibo. So definitely we do not do parang remarks na parang hindi makakatulong or mga body movement such as inappropriate smiling or laughter na hindi naman talaga hinihingi ng pagkakataon, and allowing person to speak without being interrupted. If halimbawa nagsasalita yung individual at hindi malinaw, pwede naman nating ipaulit para lang mas maintindihan natin rather than agreeing na hindi naman natin pala na nagigets or naiintindihan yung sinasabi niya. Aside from that, we need to be friendly, respectful, and non-judgmental at all times. So we do not judge their behavior or their appearance, or we stay calm and patient while listening to them. And lastly is responding with sensitivity. Kasi definitely these people might be really having difficulties or hard time sharing their experiences. So dapat maging sensitive tayo dun sa pag-respond dun sa kanilang mga sinasabi.
Ayan. Thank you po, Doc Rodney, for that. Doc Fonzie and then Ms. Lindsay po.
None to add na on that. I think very comprehensive din sagot po ni Doc Rodney.
Ayan, sige po. So ayun no, yung paliwanag ni Doc Rodney kanina no, mahalaga talaga na matuto tayong makinig at hindi na yung pagiging bully today. So kinakailangan nating maging mas sensitive sa ating mga kapwa. So para naman po sa ating susunod na question, mula kay Ms. Kat De Villa ng Philippine Daily Inquirer. Has the DOH coordinated with DepEd on the integration of mental health or suicide prevention modules in the school curriculum? When will it be implemented? Ms. Lindsay?
Hi, Nikki. Thank you for that question. I'd just like to clarify, yung itong basic training module on suicide prevention, this is not totally integrating doon sa overall curriculum ng DepEd. But this is a basic training modules on suicide prevention in schools intended for both teaching and non-teaching staff to capacitate them in select competencies, including yung skills on early identification and assessment of suicide risk, yung mga psychological first aid and active listening, suicide communication and safety planning, and suicide prevention protocol or policy drafting. So tailor-fitted to their respective schools. So mga 42 education managers from DepEd CAR, mga bureau chief, technical staff, principal, guidance counselors, teachers, medical and administrative staff participated during the training. And this initiative is part of the technical assistance ng ating World Health Organization and Australian government. So the DOH is also in close coordination with the Department of Education, of course, as to the next steps of this initiative.
Ayan. Doc Fonzie, may gusto po ba kayong i-add sa sinabi ni Ms. Lindsay? Ayan. So, ayan, nakita po natin na gumagalaw po yung programa na nais i-implement ng DOH kasama ang. So para po sa ating next question, para po sa ating mga kasamang doctor today, no? Okay lang po ba yung ginagamot lang ang mental condition pero hindi nagte-therapy? Doc Rodney and then Doc Fonzie po to answer.
Sige. The best combination for treatment when it comes to mental health condition is definitely combination of medication and therapy. Kasi talagang proven naman yung specific or parang appropriate form of therapy to really help in the recovery of the individual. Clinical experience or personal experience sa clinic, mas mataas yung relapse rate ng mga individual na nagagamot lang. Kasi ang nangyayari nun is they just somehow the symptoms are being managed or nababawasan. Pero for example, if the problem is how they think, how they see or perceive the environment, hindi yun napaprocess through appropriate na therapy session. So ang tendency is nagkakaroon lang ng relapse whenever they are again exposed to a difficult situation or to a stressor. So it's really important na actually may mga condition pag minsan na hindi kailangan ng medication pa or hindi pa indicated, pero yung therapy yun yung indicated kasi parang hindi pa siya warranted to have pharmacological intervention, but the therapeutic process ng psychotherapy is more tawag dito advantageous. Pero of course majority of the condition would have better resolution or recovery if the two approach is being used, the medication and the therapy itself.
Ayan. Salamat po for that, Doc Rodney. Doc Fonzie. Okay na po ba? Doc Fonzie, end yung answer ni Doc Rodney.
Yes. Sorry.
Okay po. Okay po. Para po sa ating next question, mula po sa ating media partner na si Ms. Dec Villanueva. Para po kay Ms. Lindsay. How were the 4 pilot sites for community-based mental health chosen? And when will the pilot tests start?
Thank you. Actually, kakatapos lang ng mga pilot testing natin for this repackaged community-based training modules. So yung mga pilot sites, pinili namin yung parang meron ng mga existing community-based mental health programs na on the ground, yung may mga local chief executives na very supportive of the mental health program para mas ma-prioritize din itong training package na ito. So ito lang yung, tsaka yung mga mga access sites din for the medicines access program ng DOH. So ito lang yung mga ilang tawag dito, kung bakit natin napili itong 4 sites na ito. And to reiterate, pilot testing pa lang ito. So we are still going to improve itong overall training package. And of course, yung learnings natin from this 4 pilot testing will form part of the overall community-based management strategy natin. So talagang inaaral po natin ngayon yung mga possible strategies and interventions pa. So hanggang makapag-develop tayo ng isang comprehensive strategy for community-based management. Thank you.
Ayan. So maraming salamat po, Ms. Lindsay. So nakita natin na talagang gumagalaw ang ating mga programa sa hagaparan ng kalusugan. So para naman po sa ating susunod na question, mula pa rin po kay Ms. Dec Villanueva ng The Philippine Star, para po kay Doc Fonzie. Among the mental health conditions na mentioned today, what is the most prevalent or pronounced during the height of the COVID-19 pandemic? If you can kindly elaborate, why is this so po?
Yeah, I don't have the exact figure, so I cannot say alin yung for the pandemic, these are the top issues. But what I would like to highlight is from the health promotion perspective, there are certain behavior risk factors that are more associated with mental health outcomes. And these include your dietary factors. So kung ang isang tao ay underweight or overweight, that has an impact. Alcohol intake also has an impact on your mental health outcomes. At the same time, I think the third factor is if you have a support group. In one of the surveys, I think it was mentioned that those who have their parents or their guardians who understand their problems or worries. So in short, nakakausap nila at naiintindihan sila nung magulang nila. That's their perception. That's what's more associated with better mental health outcomes. So even if we don't have that list of what are the top issues, there is this mix of our social support and physical health that have to go hand in hand so that we can have better mental health outcomes.
Ayan. Thank you for that, Doc Fonzie. Doc Rodney, would you like to add po sa sinabi ni Doc Fonzie?
Sige. I agree with Doc Ponzi no, na medyo mahirap i-determine kung ano yung most prevalent na mental health condition during that height of COVID kasi wala naman talaga pang naging nationwide survey na ginawa specifically for mental health condition during the COVID-19. Pero on the part of NCMH bilang having the crisis hotline, we have details that would say that during the height of the pandemic, the most concerns na tinatawag sa amin is yung mga individuals or callers manifesting or asking about anxiety and depressive episode, individuals who are calling because of some love relationship problem o kaya problem with the family, or even individuals asking for referral to a psychiatrist or psychologist, and even individuals who are asking about psychotic symptoms. So these are the top five na nature ng call na receive namin during the height of the pandemic, which is somehow different pre-pandemic. Kasi pre-pandemic, ang mga question nila is, nandun pa rin naman yung sa anxiety and depression, yung love and relationship, at saka yung inquiry about hospital services, pero hindi masyadong prominente yung psychotic symptoms. So why is this so? Kahit wala siguro tayong nakita na survey, alam naman natin na because of the restrictions in the movement and as well as yung limitations in the services of the hospital because of the prevailing COVID-19, yung ating mga dati ng service user na nagpapa-check up na or naka-maintain na sa gamot cannot really go to the hospital for them to be followed up because of the restrictions in movement. So definitely, kung wala silang medication or there's no way of reaching out to them, that the tendency or the possibility or risk of having them relapse or going into relapse is higher kasi walang nagiging follow-up or follow-through. What else? Yeah, we also know na certain studies would suggest that there are mental health conditions that are associated with individuals after having COVID-19, and usually these are individuals na naging COVID positive would have the tendency to develop depressive episode, anxiety, post-traumatic disorder, or even insomnia during the post-COVID phase. So usually ito yung mga nakikita namin. And ako din, clinical experience-wise on my practice, yeah, tumataas talaga yung kaso na nagkakaroon ng depression, anxiety, and even adjustment disorder because of the condition. So wala tayong specific na data, but yeah, sabi ko nga kanina, using the number of calls na meron ng crisis hotline, what I have mentioned earlier, those are the most prominent reason for calling sa NCMH crisis hotline.
Ayan, maraming salamat po for that, Doc Rodney and Doc Fonzie. So we are down na po to our last question for today. Still from Ms. Tech, for our last question. Under what category of mental health condition will obsessive compulsive disorder or OCD fall? When do we consider OCD to be bothersome already and will be needing clinical treatment? So para po kay Doc Rodney and then kay Doc Fonzie.
Yeah. Obsessive compulsive disorder or obsessive compulsive and related disorders yung grouping ng OCD, no? Along with obsessive compulsive disorder would be the body dysmorphic disorder. We also have the hoarding disorder. We also have the hair pulling disorder and the skin picking disorder or the excoriation disorder. So sila po yung magkakagrupo. Now, when do we consider OCD to be bothersome? Technically po, no, medyo na siya, no? Masyadong technical na kasi kaya nga siya OCD, obsessive compulsive disorder. Yung disorder itself is really bothersome na. Kasi the definition of disorder is it's taking away much of your time or your effort in maintaining the usual na self-care or interaction with others or productivity. So, yung disorder itself, bothersome na siya. So, kung halimbawa lang, no, kailan siya nagiging, yun nga, no, problematic na. Again, ang tinitingnan natin is yung impact na nito doon sa functionality. If the OC or the obsession and compulsion is now taking much of your time and effort and your productivity or affecting the way you care for yourself, the way you deal with other people, and the way you work or you attend to school, warranted na kailangan na siyang makita ng isang individual, ng isang mental health professional para ma-assess if that individual is really now having a disorder. So, Yun ang ano natin doon. Yun ang answer natin doon.
Ayan. Maraming salamat po, Doc Rodney. Doc Fonzie, would you like to add po?
Ang ating eksperto po dyan ay si Doc Rodney. Thank you.
Ayan. Ayan, sige po. At bago po tayo tuloy maghiwa-hiwalay sa araw na ito, muli, no, tinatawagan po namin kayo ulit isa-isa para sa inyong mga takeaway messages sa ating mga tagapanood. So let's start na lang po sa ating order ng presentation for today. Doc Rodney, Ms. Lindsay, and then Doc Fonzie po.
Yan, again po, no, sabi nga natin, no, it may be cliche as it sounds, but there's no health without mental health. Kasing halaga ng physical health, ang mental health, at hindi pwede na maging tawagin ng isang individual na malusog kung yung katayuan ng kanya or estado ng kanyang kaisipan ay hindi din malusog. So nang dahil po dyan, ayan, sabi nga natin, meron tayong Mental Health Act na kung saan ay sinasabi nito na lahat tayo, bawat individual, ay may kanya-kanyang gampanin para mapanatili or ma-maintain yung ating mental wellness. At kung naman magkakaroon ng mga mental health problems or mental health conditions, meron din namang mga appropriate na institutions or mga service provider na handang magbigay ng tulong dun sa mga family members or even sa service users na nangangailangan na ng tulong. Pero ang sabi ko nga din po, no, ipropromote ko pa rin ang aming NCMH Crisis Hotline dahil ito ang pinakamabilis na paraan para kayo ay makakuha ng matugunan or magkaroon ng taong makakausap kung kayo ay nangangailangan ng kausap. So dial 1553 for our NCMH Crisis Hotline. Maraming salamat po at manatili po tayong malusog.
Ayan. Maraming salamat po, Doc Rodney. Ms. Lindsay, for your takeaway messages po.
Ay, maraming salamat again for the opportunity to have us here and talk about yung mga programs of the government, of course, and other stakeholders on mental health. And gusto ko lang i-emphasize ulit na while we wanted to address all mental health condition, no, it is equally important to address also yung mga health determinants natin. Of course, by implementing yung mga healthy public policies natin, by enabling our healthy settings, making our communities healthier, our workplaces and schools healthy, no, and supportive of different healthy behaviors. So since established na yung risk nitong mga social determinants of health na ito and other associated behaviors to mental health, addressing this also would improve the overall mental health and well-being of an individual. And again, parang gentle reminder lang to be kind to everybody, and i-encourage natin ang ating mga kaibigan, mga family members to always have someone to talk to and reach out kapag ready na sila and tingin nilang kailangan na sila. Thank you.
Ayan. Maraming salamat po, Ms. Lindsay. Doc Fonzie, for your takeaway messages po.
Yes, may silang yung akin. Yung una po, tandaan natin ang mental wellness ay hindi po siya switch. It's not you're well or unwell. It's a spectrum. And you can be at any point of that spectrum at any time, no? And even in a day, no? Pwedeng magpalit, no? Sa umaga, I'm towards more of the okay. Towards the end, parang hindi. And it's okay to be anywhere on that spectrum. Yung pangalawa po, let's not undermine the importance of yung kataga na kamusta ka. Again, yung ating concern na meron kang makakausap, nabanggit ni Doc Rodney, merong mga mental health professionals na pwede mong matagan. Pero tayo, sa mga kasama natin, whether we are in a workplace setting, in a school setting, or in the community setting, or even at home, no? Ugaliin pa rin natin yung pag-check-in on other people. No? And lastly, behaviors that happen outside of the health facility, again, determine 80% of health outcomes. Even if we conduct the research to say na ito yung mga top issues, that's important. It serves a function. Right now, we can do something already. We can already practice the 7 healthy habits, one of which is to care for yourself and to care for others. Materials for health literacy, for healthy settings, and for healthy governance are already available at the DOH's platform. Or alternatively, you can also reach it through healthypilipinas.ph. Thank you.
Ayan. So muli, maraming salamat po Doc Rodney, Miss Lindsay, and Doc Fonzie sa pagpapakita sa atin ng mga practice kung paano natin ma-maintain na healthy ang ating mental well-being, gayon din ang mga available na services at mga ihahatid pa natin moving forward. At muli, mula noon hanggang ngayon, nagpapasalamat po kami sa ating mga media partners sa patuloy na pagiging katuwang sa pagpapalaganap ng tamang impormasyong pangkalusugan. Health is life, sabi nga kanina, no? At walang health kung walang mental health. Kaya mabuti pong hindi lamang ang ating pisikal na pangangatawan ng ating pinangangalagaan kung hindi pati ang ating mga isipan. Muli po, isang huwana mula sa Kagawaran ng Kalusugan. Ako po si Nikki Necesario at kita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po at sama-sama tayo sa isang healthy